Welcome to another episode of Dr. Doctor, the award-winning radio show and podcast featuring your physician host, Dr. Tom McGovern.
And I'm Dr. Chris Stroud. And this is the show where we and our guests discuss relevant health-related topics, and we do it from an authentically Catholic perspective.
Today, we will have two guests in serial, not parallel, and that always confused me regarding Christmas tree lights. Thankfully, we're doing something simpler here than wiring a Christmas tree. Yes. Anyway, they will be heard with us across the EWTN Global Catholic Radio Network. Joining us first will be physician assistant Megan Kreft of Portland, Oregon, who was fired by a Catholic hospital for practicing consistent with Catholic beliefs about human dignity.
And then after listening to Megan's story, we have the famed Dr. Ashley Fernandez, pediatrician and medical ethicist from The Ohio State University, who's going to provide commentary on Megan's story and try to help us understand sort of this misplaced primacy that patient autonomy has come to hold really in the minds and the actions of far too many people and organizations.
The idea for this episode actually came from our co-host, Andrew. He received a text from a practicing Catholic physician assistant student, and he wanted to know how to respond when patients requested oral contraceptives. And he was being told, well, if that's what the patient wants, that's what the patient gets. Patient autonomy rules. And it's a common question that medical PA and nurse practitioner students have, especially at our Catholic Medical Association events.
Speaking for Andrew as well, I think that we would hope that an episode like this could become sort of a tool that others could put in their tool bag and use when they feel like they need to confront these kinds of issues. You know, maybe this will become a prerequisite for the boot camp each year, and that'll set the stage for incoming students. But make no mistake, whether you're a student or not in Catholic healthcare, you need to have this tool and be ready to use it.
In reflecting on how to put together this episode, I was reminded of something I learned about in the last few years that's called the Platinum Rule. We all know the Golden Rule, but the Platinum Rule says, do unto others as they themselves would have done unto them. And I was fascinated to read that people state that this overcomes the so-called insensitivity of the Golden Rule of Matthew 7:12. Who knew that Jesus was insensitive when he said, do unto others as you would have them do unto you? So we plan to ask Ashley about modern writers who see the Golden Rule as wrong-headed and the Platinum Rule as its corrective. But I further noticed the Platinum Rule could also be a wolf in sheep's clothing. It might seem good, but if one follows it to the end, we see that autonomy becomes the greatest good. But he's the ethicist. I'm not, and I'll let him educate all of us.
You know, for me, and listening to these two great speakers, I hope that we and our listeners can take away that this is noble work, and we have noble, or I should say, worthy adversaries, and we need to be prepared. As St. Paul reminds us, we need to be able to give an account for the faith within us, and we've got to be able to speak up for the teachings of the Holy Church because she's right. She's always been right. She'll always be right. And this is just another example of the things we've got to be prepared to do as Catholics in healthcare.
Before our break, because we really want to get to these two strong guests, I will pose our medical trivia question of the day. And not surprisingly, the theme, the topic, the category is medical ethics. Now, the American Journal of Bioethics was established in 1999. The Journal of Medical Ethics in Great Britain, published by the British Medical Journal, gave birth to itself in 1975. But before these two came the oldest and first journal of medical ethics in the world in 1932. Your question: what is the name of the oldest journal dedicated to medical ethics? And here's a hint. It's named after a man who was physician for King Henry VIII, founded the Royal College of Physicians in London, taught both Erasmus and St. Thomas More, and then became a priest in the year 1509, 15 years before he died. But to get to the answer, you got to listen to the rest of this tremendous show here on the virtual studios of Redeemer Radio on the EWTN Global Catholic Radio Network.
Welcome back to Dr. Doctor from the virtual studios of Redeemer Radio. And as we mentioned earlier, we're joined by Megan Kreft, who's a physician assistant, or PA, as we in the doctor world often say. She's practiced in the field of family medicine. She attended Oregon Health Science University for her medical education and master's in physician assistant studies. And she's currently pursuing additional education as a Creighton model fertility care practitioner and nanotechnology medical consultant, just like me, I must say, through the St. Paul VI Institute in beautiful Omaha, Nebraska. She was born and raised in Oregon, where she currently resides with her husband, Isaac, and almost 3-year-old son. And they are expecting child number 2 this fall. Megan, welcome to Dr. Doctor.
Thank you so much for having me. Excited to be here.
Well, we're glad to have you, and we're even more glad to have your story.
Thanks.
Well, let's start off because we've already told our listeners about your greatness. But why don't you tell us about your experiences training to be a physician assistant in Oregon and what that was like and what that entailed?
Yeah. So I initially saw my call to practice medicine as a vocational calling, really rooted in a desire to serve others and accompany my patients on their journey towards ultimately health and healing mind, body, and spirit. And I recognized that there was this need for medical care that respects the whole human person and the sanctity of all life, from conception to natural death. I felt like I had eyes pretty wide open pursuing my medical training at OHSU. I assumed that the expectation would indeed be to leave my faith at the door and not let it compromise patient care. And I came head on, face to face with the culture of death in my PA education. I even had a preceptor who refused to work with me during my clinical year due to my religious beliefs.
How tolerant of them.
I know, right? Yeah, exactly. And ended up actually working with the Title IX office at OHSU to create a formal religious accommodation that would allow me to continue in the program and finish my education without partaking in services that violated my conscience and the dictates of my faith. So as you can imagine, I finished up PA school coming up about 2 years ago, and I felt really burnt out, honestly, from all the ethical dilemmas that I was facing, all the pushback, and just being confronted head on with the culture of death. So I pretty much ruled out and felt that it was impossible for me to pursue any clinical practice in primary care or women's health due to these dilemmas that I was continually facing.
And did you feel that that was fair, that that was right? Did you feel like, Megan Kreft could be that person?
I felt really discouraged. I didn't think that it was fair. As a PA, we receive a very generalist training, and PAs are heavily utilized in the primary care setting due to our cost effectiveness as well as increasing access to care. And so it felt like there was a whole field of medicine, several fields, that I was precluded from even working in, which was very discouraging. Not only is medical education challenging and difficult for Catholics and those who are pro-life to pursue, but then once you're out of school, there are very few employers who actually are supportive of practicing, providers practicing in a way consistent with their faith and conscience. And so although I was burnout, had ruled those out, I did recognize that there was a need, especially in these fields of medicine, for providers who are committed to providing life-affirming care to their patients and upholding the sanctity of human life.
So Megan, for our listeners who may be students or contemplating being students, let's back up a little and give us an example of what confronting a conflict like that looks like, because people are wondering what, they wouldn't let you off on Sunday to go to Mass. Help our listeners understand exactly what that could look like.
Yeah, exactly. So a big part of my education was primary care, and packed into that is a lot of women's health. And so, in a typical clinical day, many patients will come in, and a common thing that's requested is birth control. And so I let OHSU know that I wasn't going to be prescribing or be involved in patients receiving hormonal contraception. I wasn't going to be involved in abortion services or referrals, as well as anything else that violated the Catholic Church's teaching on the sanctity of human life. So another issue that would come up, I remember one of my clinical rotations, there was a young child being brought in for hormone replacement therapy for gender transitioning that I excused myself from. But we were expected to, place IUDs, Nexplanon, be involved in all of that. And that was, I made it pretty clear, was not something that I was going to participate in.
So after running that gauntlet of training, being burned out by all that confrontation, I remember that was awful going through that. What job did you then seek and accept?
Yeah. So like I said, I was burnt out. So I initially had my heart set on working in a medical specialty, kind of to sidestep having to deal with this stuff on a day in and day out basis. Not that there aren't ethical dilemmas that we encounter, and not that these other specialties are opportunities to evangelize or integrate our faith into our patient care. But I eventually ended up opening up my job search to family medicine and women's health, and found a position in family medicine at our local Catholic hospital system at an outpatient clinic that happened to be in the town that I grew up in. And I figured, even though, and this is Providence Health and Services, even though I didn't think that they were a bastion of Catholic healthcare, I at least figured they had to be at least tolerant of my insistence on practicing medicine that was consistent with my Catholic faith.
Because they're supposed to follow the ethical and religious directives put out by the United States Council of Catholic Bishops, or known as the ERDs. And that gave you some solace, didn't it?
Yeah, exactly. Yep. So I was offered a position in family medicine as a physician assistant at Providence Medical Group, Sherwood, again, an outpatient primary care clinic. And I was delighted in reviewing my proposed employment contract to find a section of the contract that explicitly stated, and I'll quote it for your listeners: "Clinician understands that all Providence facilities, including its hospitals and clinic, are Catholic facilities, and the clinician agrees to conform to the Providence Health and Services mission and core values and the Roman Catholic moral tradition as articulated in such documents as the ethical and religious directives for Catholic healthcare services."
But you found out that that was false advertising.
Yeah, exactly. I remember reading this and thinking, this is too good to be true. I understood that likely there wasn't universal adherence to the ethical and religious directives within the organization, but I was reassured that not only would I be tolerated in practicing according to the dictates of my faith and conscience, but I was actually required to. So I accepted the position.
So Megan, spoiler alert for our listeners, just because there's the Catholic logo on the sign, the hospital may not be Catholic. We've talked about that on this show with several guests, but it's one thing to talk about it. It's another thing to confront it in real life, as you did. But you thought you had the answer because of this statement. So move on and tell us what happened next.
Yeah, exactly. So my first inclination that anything was awry in my clinic was I received a list of procedures and providers that provided those procedures before I even started practice. And on that list were IUD and Nexplanon insertions, vasectomies, and the prescription of Plan B. So this is specific to my clinic. I was actually really surprised how transparent and nonchalant the clinic was in advertising these services that they provided that were explicitly contrary to the institution's policies. I had a physician recommend I refer for an abortion within the first few weeks of me being there. I had a patient request a tubal ligation, and I found out that the organization had a contraceptive quality metric as well.
So what did you do when you met this? I mean, did you talk to someone? Did you do something? Did somebody say, we don't like you anymore?
So I realized I needed to have a conversation with my clinic manager. I thought it went without saying. I didn't think that I needed to clarify my practice preferences as a Catholic practicing within a Catholic healthcare system. And she was fairly receptive to my beliefs. She recommended I follow up with my supervising physician, who was our medical director, as well as Providence's ethicist. I had a conversation with the chief mission integration officer of the organization, who told me when I highlighted that the ERDs were not being integrated as part of the practice that, well, we just don't police providers. It's not practical. We can't police everyone. At this point, I reached out to the National Catholic Bioethics Center and was put in contact with Dr. Joseph Zalot and alerted him to my concerns, and also just asked him the practical questions. How do I navigate these requests for services from patients that I don't provide and that the organization purports not to provide? And he walked me through step-by-step how to address this, particularly in the realm of medical bioethics pertaining to referral versus transfer of care.
And so you did this, and yet Providence wanted to fire you. Why? What happened?
Yeah, so I ended up talking to my medical director, who expressed that contraception was a huge part of women's health. She was concerned about patient satisfaction scores and clinic ratings, having me see patients and not provide these services, and also expressed that the expectation was that every woman of childbearing age coming into the clinic, no matter what question or what chief complaint, was to be asked the question of if they wanted to become pregnant in the next year, and if they said no, that I would be expected to counsel them and recommend birth control options. I was quickly alerted to the fact that I was prohibited after this from seeing any woman of childbearing age. This cut out the patient population of females 12 to 50. And this was a population I cared a lot about. And I realized that the reason why I was no longer able to see women of childbearing age was because of how I would handle their request for hormonal contraception. And it became apparent that the clinic preferred positive messages about contraception being relayed to patients, which in my mind was a huge red flag in the area of informed consent. I actually ended up at this time deciding to pursue training at the St. Paul VI Institute. I went to my clinic director to have my continuing medical education approved through the organization and was told it could not be supported or approved because it wasn't relevant to my job since I didn't see women.
Oh my goodness.
Well, Megan, what do you help us and our listeners? What do you think accounts for a Catholic institution not behaving Catholically?
Yeah, no, great question. I think a common thing that comes up is this whole notion that many people have bought into, that we can't push our beliefs on others and we can't let faith be a conflict of interest or compromise patient care. An excuse that was repeatedly brought up was we don't police our providers. The provider-patient relationship is private and sacred.
But they were policing you.
There was a double standard there that I noticed. And, I was even told by their ethicists that Providence allowed tubal ligations for women who couldn't afford more children, and that was actually consistent with Catholic social teaching, and that was part of concern for the poor. So really one of the highest values that kept coming up was the value placed on how the patient felt about their healthcare encounter. Did they get what they wanted? Were they comfortable? Did they feel supported? Will they come back for further services? But really, as providers and those in healthcare, we have a duty to speak truth and have difficult conversations with our patients and advocate for their health. I can think of several instances where, I'm talking to a patient about weight loss or smoking cessation. And they probably left the exam room not feeling super supported or like they heard the message they wanted. But I have a duty to advocate for my patients and share the truth.
So what popped the boil? What is it that led them to say, you're out the door, Megan?
Yeah, so as you can imagine, I was probably a thorn in many people's sides at this point, less than 6 months into my first clinical practice. But I had a patient that during this time of flux, when they were deciding to restrict the patients I could see to no longer include women, I saw a young female for a follow-up visit on a chief complaint that was not related to family planning. And she asked for Plan B prescription. I told her that I didn't provide the service and I didn't refer for it, yet I offered her other medical assistance and support. She ended up asking me, do you not prescribe Plan B for personal reasons, or is this Providence policy because it's a Catholic hospital system? And I didn't hesitate at all to say, it's actually Providence policy. As I stepped out of the room to order some labs, I realized I couldn't submit a lab order because my medical director was currently in my visit chart prescribing the medication to this patient.
Oh my goodness.
Yeah. So I was then kind of what broke the camel's back was I was called to a meeting a couple weeks later with our regional medical director and my clinic director. And I was told that I had traumatized the patient for not prescribing what she had requested, that I had broken the Hippocratic oath, that I had done harm. And I came to realize, yes, this patient was experiencing trauma, but she came into my exam room having started to experience the trauma of the situation she was in, fear of an untimely pregnancy, concern for STDs, and then the social implications of connecting with an ex-boyfriend. So where that ended up going was ultimately I was required or instructed by ultimatum of threatened termination to sign a performance expectation document that stated that if a patient requested services I didn't provide, that I must refer them to another Providence provider. Obviously, I couldn't sign this because it violated my conscience, my faith, but also my employment contract.
Wow. So you then left. You've since settled with them in a mediated settlement. You cannot reveal the details of it, but you are permitted to speak freely about what happened. And yet you have something ongoing with the Department of Health and Human Services Office of Civil Rights. Tell us where that stands.
Yeah, so we had a complaint. I worked with the Thomas More Society, a religious liberty law firm, and we submitted a complaint to the Department of Health and Services Office for Civil Rights And I was actually have had a conversation with one of their lawyers, and they expressed concern that Providence Medical Group was receiving federal funding while there was concern for possible religious discrimination in my case. And the last I heard from them, they said that they would be in touch with me soon to follow up on that.
And hopefully there'll be follow-up in the National Catholic Register, where we can find an article about Megan's story toward the end of June. Megan, one last question. What advice would you have for listeners who are healthcare professional students and want to practice according to the Catholic faith?
Yeah, so I'll leave your listeners with a quote that I find great comfort in. It's from St. Teresa of Calcutta. She said, "God has not called me to be successful. He has called me to be faithful." This is comforting because it calls us to be faithful to God with what is in our purview. We don't need to be worried about the things that we can't control. But I would say education is key. Steep yourself in the teachings of the church, particularly regarding the sanctity of life and bioethics. Familiarize yourself with the ethical and religious directives for Catholic healthcare. Seek out resources and support, such as the National Catholic Bioethics Center. Don't be afraid. Speak up, ask questions, seek support, and take heart that the beauty and truth of our Catholic faith is consistent with science and what is best for the human person, including our patients. You're not alone, and God is always faithful.
Courageous Catholic PA Megan Kreft, thank you so much for being with us on Dr. Doctor. And we'll be back shortly with an analysis and more wisdom